Thanks for staying with us here. We are live on Joy 99.7 FM, also in Kumasi and over 30 affiliates across Ghana's 16 regions. We are live on Facebook, also on myjoyonline.com. Tonight, the Ghana Health Service is on aggressive hunts for the source of the outbreak of the deadly Marburg virus disease, which has killed 2 persons in the Ashanti region. Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu-Bekwin, says the service has begun an aggressive contact tracing. So earlier, 98 people were under quarantine as suspected contact cases. However, he says 39 have been discharged after they were cleared by authorities for not exhibiting the symptoms. He says his outfit will increase surveillance. We can hear from Dr. Asiedu-Bekwin, who spoke to my colleague Ernest Meno.
We have 98 contacts, but at the end of today, we'll be discharging 39 of them. They would have completed their 21-day maximum follow-up.
Would you say the rest who are in your custody or who are being monitored are also doing well and are not showing severe symptoms?
Yes, so this 98, it was only one that showed some symptoms about a week ago. We sent samples to the lab and it's negative. So far, none of the 98 has showed any symptoms. They are still being monitored on a daily basis and they are fine.
Your statement indicates that so far, beyond the cases that have been recorded, you haven't seen any or recorded any case yet. What is your plan to increase surveillance and nip this in the bud?
Yes, so our approach is about containment at source. So what we are doing is that we are making sure that we identify all contacts, keep a close eye in the community involved. We are involving our community-based surveillance volunteers who have a better view of the community, so that if the case occurs, we immediately detect and then manage. And that's what we are doing. And let me also say that our hospitals have designated holding rooms that will manage the case. We've been having coordination meetings for all our partners, everybody's interested, including the wildlife, about how to actually curtail this outbreak.
Because the disease is zoonotic in nature, are you involving the wildlife department, for instance, and what role would they be playing in your grant scheme?
Yes, so we are actually involving the wildlife in our discussions, in our meetings, because the idea is to find the source. As of now, we are not very certain about the source. We know that the food bat is the reservoir, but it's not very common to actually isolate those things in Ghana. So we are working together to be sure how it got into the locality and then how best we can prevent future occurrences.
Should you suspect anyone who is showing symptoms, what are the channels of reporting? How should we go about this?
That we have a several system that moves from the community to the district, to the region, to the national. So we have community case definitions, we have clinical case definitions that is used to pick cases. So let's say if the community volunteer find a case that looks like one, you just notify the health system goes to verify, and then will now go through the proper case-based surveillance system. And so that's what we have been doing over the period.
So that's the Dr. Franklin Asiedu-Bekwin there speaking to Ernest Meno. He's the Director of Public Health at the Ghana Health Service. And speaking of the Ghana Health Service, they've since issued a statement on what to look out for. We know already that we are dealing with COVID, we are dealing with influenza now. We have Marburg on our hands. Evans, you've been looking at that statement. What exactly are we looking out for when it comes to the Marburg disease?
So symptoms, according to the Ghana Health Service, includes fever, bloody diarrhea, bleeding from the gums, bleeding into the skin, bleeding into the eyes, and then bloody urine. So these are the symptoms. And if you read the literature on this, according to the BBC, this particular virus belongs to the family of Ebola. So the fatality is very, very high. And I mean, just the symptoms alone will send shivers down your spine.
Well, it's sent a lot of shivers down my spine already. But let me bring in Dr. Michael Owusu. He's a virologist with the Kumasi Center for Collaborative Research. Thankfully, we also have the General Secretary of the Ghana Medical Association, Dr. Titus Bayu, also joining us. But let's start with you, Dr. Michael Owusu. We are grateful for your time once again. Really, Evans has been giving us some of the symptoms and how deadly this viral disease is. How are we supposed to be dealing with this particular virus, knowing that 2 persons have already died as a result?
Yeah, good evening to you, MFR. Good evening to all your listeners. So this is a virus that we've all been hoping and praying that we don't have its kind in Ghana. The last time we had Ebola in Liberia, Guinea, Sierra Leone killed about 11,000 people. So these are viruses that are difficult to deal with on the African continent because of its modes of transmission and the fact that it is well integrated in our culture. Our cultural practices tends to expose us a lot. I mean, during the Ebola, within Liberia, one of the major routes of transmission is through, bodies. Taking care of dead bodies and funeral, all these processes. Because when it comes to Marburg, when person dies, he becomes more infectious compared to viruses like COVID. And because it's difficult for us to delink ourselves from handling bodies of this nature, dealing with it on the continent has become a problem. So identifying this is more of a high alert for us as a country. And I'm happy that the Ghana Health Service seem to have some good strategies in place to deal with it. And I hope that with the experience we've had with COVID and all the surveillance strategies we have, the contact traces and community-based surveillance approaches, we should be able to handle it in a way that will not get out of hand.
But speaking of the strategy in place, thankfully you are in Kumasi, and these cases we are told were recorded in the Ashanti region. What specifically are the visible strategies that are being deployed in the Ashanti region, for instance, by the Ghana Health Service that gives you confidence that we have a hold on this virus?
Yeah, for me, I think one of the things that I was happy about is that the ability to detect. So if you have monitored Ebola, Marburg in different countries, Kenya, Uganda, people die because of late detection. So by the time you see, many people have carried the disease and bodies have been, put somewhere, people have handled and people have transmitted. But in Santi region, once you suspect a disease, you have to collect a sample, channel it through the system, if that KCCR or Nguchi or the public reference lab. Once it's detected, the feedback is sent back to the region for them to take an action. So once the cases were identified, the samples were confirmed, and therefore contact tracing and things were done. This is what we're informed, and this is what I've seen, that at least for many who have come into contact with these patients, they are under observation, they are being monitored with the hope to see if any of them will manifest the signs and symptoms. If not, then of course it means that we are doing well. But then in case you have some of these experience with them, we have to raise the alert and see how best to deal with them. But the aspect of education is what is a bit on the low side because we know bushmeat animals are one of the major reservoirs of this virus. So at this level, we need a lot of education for people to understand that we are dealing with something more different than COVID. And therefore, those who are highly dependent on bushmeat and handling dead animals or processing meats for food or restaurant have to be very, very vigilant. If possible, reduce or put a brakes on some of this. I think that having some more education, especially in the local language, at these communities would be very helpful to possibly reduce further transmission in case you have the reservoirs still circulating in the communities.
Okay, but Dr. Titus Bayu, as soldiers, you will be in the front line again, together with your members in dealing with this Marburg. Let me find out first off if you are, or the Ghana Health Service, for instance, is collaborating with you, for instance, in dealing with this, or are we waiting at a point before you are brought in? What really is the role of the Medical Association?
Okay, thank you very much, Araba, and thank you for having me. I think I want to commend the health service for the role they have played so far and commend the clinicians and healthcare workers who played a role in helping us detect these cases. It had to take a high index of suspicion for them to pick them up. And to the extent that we do not have casualties among these health workers as of now, suggests that the standard infection prevention and control measures were applied. And so I would think that so far the measures put by the health service is good. There is an EOC for outbreaks like this that the GMA is represented on that committee. And so we are part of it right from the beginning. Our members are the clinicians, health physicians who are also helping with this. So we are involved right from the beginning.
Well, just 2 persons, I should say, have been killed. But we saw that 98 people were, taken in for contact tracing purposes. My concern is, it looks like this is very deadly. Are we going to die?
Hopefully not. Based on the actions taken by the Ghana Health Service so far, I think I have confidence that the situation will be contained and we are not going to die. But we should be aware that this is a disease that has a very high fatality. And COVID doesn't come anywhere close to this. In fact, a colleague joked that this is a senior brother of Ebola. We never saw Ebola in Ghana, but we saw the devastation Ebola caused in other countries. So it is very deadly, and as you can tell, for now, it will seem that our case fatality in this country is 100%. All the 2 who had it have died, and nobody has gotten it that has recovered. But there have been instances where people have recovered from this disease. We also need to be aware that at present there's no vaccine for this disease. So containment, prevention of spread is what we need to do. And for us, the general public, it's not for us to be alarmed and scared, but be vigilant. As has been suggested, the symptoms are very vague, and they very much mimic a lot of common diseases. The fever, any of our malarias can give fever. Bloody urine, there are other conditions that can give that. But in the dispensation that we find ourselves in, if you find any of these, you must report immediately to the hospital. We must also be careful how we handle the dead. If somebody dies and we do not know what caused the death, if the person had a bleeding problem before, fever, bloody diarrhea, you don't go handling that dead body out of your love for the body, because that can lead to a lot of spread. So we just have to be cautious and be more vigilant as a people.
But is there a particular thing that we need to do beyond being cautious? Because there's bleeding into the skin, amongst others. Are we supposed to go back to washing our hands, wearing masks? Is there a specific thing that we can be doing as individuals?
Washing of the hands is very useful for this condition. Not touching dead bodies with your bare hands is also very useful. Data suggests that if you sleep in the same room with an infected person overnight, then you are really at an exposure, and your risk of getting it is high. You need real contact with a person or their bodily fluid. So you may want to minimize our interactions and hugging and touching people unnecessarily, especially when they are bleeding or it is the coughs that we are dealing with. These you have to be careful, and then wash our hands with soap and water frequently, and then observe all the other protocols that we have put in place for COVID. Even though COVID spreads faster, if you avoid COVID, you probably avoid this as well. This doesn't spread in the air. It has to be contact. And therefore, the hand hygiene practices, the physical distancing bit of the COVID protocol is very relevant in this condition.
Well, so just briefly also, we've been arguing it out in the studio about this. So you know that COVID, when you are asymptomatic, the effect amongst others, we've been getting education on this. But you know this has an incubation period of 21 days. So would you start showing symptoms the very day you are infected? And are you able to infect anyone if you've not started showing symptoms?
So you don't start showing symptoms the very day you are infected. you have between 2 to 21 to show symptoms. That's why we call it the incubation period. Generally, you will not spread it unless you are showing the symptoms. The symptoms here, I'm referring to bleeding or some other body fluids of yours. In the community, worker, yes, if the disease is in your blood and we are working with your blood and you make things that we can still be infected. But within the community, you need to exhibit the symptoms of bleeding and other bodily discharge to really increase the risk of spread. So somebody having it and that's walking in the public or sitting in a room with you, your risk of getting this is not that high. But if the person is bleeding, is having any discharge of fluid, and you come in contact with that, then your risk goes high.
And we are told you can even get it through sex and kissing?
Yes, it lingers on, especially in semen. Even in people who have recovered, it has been isolated in their semen after months. So, sexual practices that use this barrier methods are encouraged for people who have even recovered from this disease until we have proved that it is no longer detectable in their semen. So it can spread through the sexual contact, and it can spread through bodily fluids of which sexual genital secretions are part of.
We are grateful. That's Dr. Titus Bay, who is the General Secretary of the Ghana Medical Association. We also heard from Dr. Michael Owusu. He's a virologist at the KCCR. You've heard it for yourself. It's time to take precaution.